Hello and welcome to the fourth annual Sources of Strength Ohio Conference. My name is Evie Roberts and I'm the Youth Program and Policy Manager at the Ohio Suicide Prevention Foundation. And it's my privilege to represent OSPF as the leader for Sources of Strength Ohio, the host for today's conference, and the initiative responsible for bringing Sources of Strength to as many Ohio schools and communities as possible. First, we're going to start with our keynote, Collaborative Prevention, Supporting Best Outcomes Through Diversified Programming. Our brilliant keynote speaker is Ben Miller, LPCCS and Project Specialist at the Center for Suicide Prevention and Research at Nationwide Children's Hospital. I've had the privilege of working with Ben for a little over 3 years since he began working on a joint project between our organizations called Be Present Ohio, the Online Experience, or BPOXP. I've learned a lot from him in that time and have endless gratitude for the time and attention he's invested in BPOXP, overseeing the program's statewide launch and on the hunt for every technical and technological bug that could appear. It's through this work that I came to ask Ben if he'd be willing to provide the keynote address for today's events. Schools and community-based programs that reach out about BPOXP or Sources of Strength often want to know how our programs fit into existing prevention infrastructure. What can our programs do that others can't? Which ones best complement one another? And what's the best way to layer prevention programs together? Ben has become adept at answering this despite the fact that there's not a lot of research on this topic. In that way, he's quite literally one of the best resources in the state whenever it comes to building a comprehensive suicide prevention approach in our schools. And Ben's keynote really represents the theme of today's conference, which is all about integrating new approaches, policies, and programming into our suicide prevention work. We don't just pick one thing to do and expect it to save lives. Rather, we pick one thing, then another, and hoping that it will be enough to keep our youth and our community safe. As you watch today's keynote and breakouts, I hope you feel inspired to strengthen suicide prevention programming in your school. It could be by adding Sources of Strength to your existing regimen or by adding a new approach to strengthen existing sources programming. Either way, we thank you for being here and we hope that you enjoy your day with us. Without further ado, Ben Miller, welcome to the stage. Thank you so much.
Morning, everybody. Evie, thank you for the kind words. It's always humbling. And I appreciate y'all inviting me to be here this morning and being willing to take your time out of the day to attend a prevention conference. I know that is something that eats into all of our busy schedules. But really, what we know in best practices in kind of this space is the more we have local community members, local trusted adults who are involved in doing this work with our young people, the better outcomes that we have. And so I really just want to say thank you all for taking your time to be here and kind of spend our time talking about some prevention stuff here today. As Evie mentioned, though, my name is Ben Miller. I am a clinical counselor who works at Nationwide Children's Hospital in the Center for Suicide Prevention and Research. I've been here at Children's for a decade now. It'll be a decade in a week, doing prevention programming and clinical interventions. I used to be on the inpatient units and in the emergency department doing suicide crisis and homicide assessments. And I used to be community-based crisis as well. And now I spend my days doing prevention programming and helping people kind of understand how we can best keep young people from necessarily needing those higher levels of intervention that are so disruptive. They're life-saving and they also aren't always necessary. And so we look at what are ways that we can help young people out in the community as we are kind of noticing day-to-day changes and struggles that we can come alongside them at kind of that local level. What we're going to talk about here this morning really is going to be looking at kind of the prevention landscape we have right now. So we're going to be spending some time talking about kind of what are the legal requirements we have right now and how do those legal requirements in some ways actually differ from what we know best practices are in the prevention space and how we kind of reconcile this difference between the two that we have. Also, before I keep going, I will let y'all know I have a 2-year-old at home who is great at sharing germs, so I'm getting over a bit of a cold. So I'll be coughing and drinking my tea a little bit as we go today. So just bear with me on that. I apologize. Once we kind of go over this kind of big picture of what our expectations are right now, though, and kind of how we can reconcile the differences here, we're going to look at kind of how are we actually going to apply prevention programming in the best ways that we possibly can. And I'm going to have a lot of caveats as we go through and talking about, essentially, there will be some things that I talk about today that are going to be kind of, I'll use the term textbook, like what would we like to see in a textbook? And just know, though, that when I talk about things like that, I very much am of the belief and opinion that textbook information is wonderful. However, in order to actually make that functional to our lives and applicable for our young people, we have to be able to adapt that and be able to work it into different environments and be flexible in the ways that we use these things. So I'm going to be talking about how we can kind of do that as well as we go through prevention programming and how we can kind of take steps towards better and not necessarily beat ourselves up if we're not at best today. After all that, I'm hopefully going to leave a little bit of time here as well for y'all to kind of break out into some smaller breakout rooms to have some conversations with each other before we come back together, kind of wrap things off, and then send you all off on your merry way for the rest of the day. First thing we're going to touch on here is going to be some background information from what's called the Youth Risk Behavior Survey. Some of you may be familiar with this. For those of you who are not, though, I'll give a kind of a quick summary here. Basically, what this is every 2 years, the CDC does an anonymous survey of the entire nation of young people. It is broken down to county level. It's kind of how it's brought back to be analyzed. But it's looking at essentially risky outcomes for youth and kind of different things that contribute to that. So it talks about or asks kids about things like, what's their housing situation, what's their academic situation, legal questions, substance use questions, all sorts of things. But one of the things that it looks at is mental health questions, mainly specifically on focusing on suicide and depression. So what we have here is they don't have the 2025 data out just yet. So we're looking at 2023 for this one. But just kind of a little bit of where are our young people at right now. That's really what this Youth Risk Behavior Survey serves as, is a way to kind of get a pulse on where young people are. And so most recently, what we know is that our young people are not having the best times. And we would, and this is not a surprise to many of you, I'm sure, we would like to be seeing things a little bit different. But what we're at right now is about 40% of our young people, so about 4 in 10, reported that in the past 2 weeks from taking this survey, they reported persistent feelings of sadness and hopelessness. When we look at this is kind of our one quick question indicator for the number of young people who may be experiencing major depression. When we look at all the kids surveyed, there was about 20%, or about 2 in 10 of our young people have seriously considered attempting suicide due to whatever factors may be going on. They've been saying, hey, this might be something that I could do as attempt to end my life. 16%, about 1.5 out of 10 students, actually reported that they had made a plan on how they could attempt suicide if they chose to. And then 9%, so just about 1 in 10, actually reported that they had attempted suicide. So we know that our young people right now aren't necessarily having the best times. And that is an unfortunate thing. And one of the things that we do know looking back on previous years of the Youth Risk Behavior Survey is that this is unfortunately something where the numbers are going in the wrong direction. We're seeing more and more youth every year who are experiencing challenges. And so we as a field have been doing a lot to try and combat that. And part of what you guys are doing here today is to try and push back against that. And we are actually very blessed right now to be in a time where we do have a lot of clinical interventions that are extremely effective. We have things like acceptance commitment therapy, dialectic behavior therapy, cognitive behavioral therapy. We have suicide-specific education and interventions like the ASSIST program, like CAMS, like CALM, lots of different things that we have that we know work when we are able to kind of address concerns that we know about, when we are aware of a challenge that a young person is experiencing and be able to get them in to receive services. We also know that at this kind of universal level here, that school-based programming is also extremely effective. For the big ones that we kind of have the most research on right now, as far as kind of where we draw a lot of, this is why we know this works, or these are the programs that we know really, really work well. We have the Signs of Suicide program. That's one that's approved for the House Bill 123 list. We'll talk a little more about that later. We have the Sources of Strength program, also approved for House Bill 123. Fantastic program that you guys are going to spend the rest of the day talking about here. 2 programs that are not on the House bill list, but that I always just like to call out for their evidence backing. One is called the PACS Good Behavior Game. It's run by the Paxos Institute. This actually came about in the mid-1900s, shortly after World War II. But this is actually a program that is implemented in kind of like kindergarten, first grade, plus or minus a year, that is teaching social and emotional learning skills at a young age in the classroom setting. They do it through a lot of fun and a lot of games and a lot of kind of social skill building. And there's fantastic longitudinal evidence about how this type of education, especially starting young, has lasting impacts through some longitudinal studies on reducing not only suicide, but things like substance use, increasing academic performance, general emotional health and relationship health. So lots of different indicators for this type of work. We also have a program that's called YAM, or Youth Aware of Mental Health. And this one comes out of Europe. And this one is actually, unfortunately, not on the House bill list as of now. But it is a program that a lot of the world uses, and it's starting to work its way into the United States. Our center does some work here in the Columbus area using this program. It's also in Montana, Texas, it's either Iowa or Idaho, and then somewhere in New England. But this is a program that is a mental health promotion program, and it actually has some fantastic evidence behind it as far as supporting a lot of similar wide-reaching outcomes similar to the PACS program does. And we'll kind of talk about this as we go through here. This is actually a program not on the House bill list, even though it would very well fit within some of the requirements on there. So we know that we have these programs that work. We know our young people aren't doing well. And unfortunately, even though we have these programs that work, we still haven't been able to really see as much of an impact as we would like to. Going back to this chart shows 2007, but you can go back further if you would like to. Our suicide rates among our youth have been increasing for years and years. And unfortunately, a lot of the gains that we make aren't necessarily turning back the clock, but more slowing down or having a year where we pause the rate of increase. So we know that suicide still ranks either as the second or third leading cause of death, depending on the year and the state, but it oscillates kind of back and forth between suicide and homicide. So we have all these interventions. We know these things work based on the research, but we still aren't seeing this kind of impact that we would like to see out in the community. And so one of the things we're going to talk briefly on here is why is this? Why are we seeing this kind of disparity between the two? And we could people do PhD programs just on this. So I'm going to be very high level as we kind of do a quick overview of this. And we're going to focus kind of in the limitations to this universal space, this prevention space, since that's what we're all here for today. We have a lot of barriers that prevent us from actually being able to bring programming that we know is effective and evidence-based into the environment, into different schools, into different community organizations and groups. One of the other things that's not on here that I'll just briefly call out is I am so appreciative of all the work that our school folks and partners do. A lot is asked of you guys, and it is a fantastic place to be able to work with young people. However, one of the other things that whenever you have advocacy options for is in the community setting and community groups and partnerships, being able to encourage them as well to be able to work on prevention programming outside of the school setting so that this is a system or an ecosystem that we're building in our communities, not just something that we expect to happen, between 7 and 3 during a school day. But some of the barriers here we know for schools, okay, and kind of getting this prevention work out here. One is schedules. There's a lot of things that are asked of you guys in a day and for you guys to cram all in. Prevention programming is just one other thing. When we think about talking with admin about, hey, how should we manage this? How should we fit this in with testing? That's an extremely challenging thing to do with all the other requirements y'all have. We also know staffing wise, like behavioral health, we are in quite a staffing shortage here in Ohio. There's not enough of us to see the number of people who need served. And I know from my friends in education that y'all are in a similar boat as well. There's not enough people who are willing to be in there in the schools and trained to be doing that work that we need for educating our young people and keeping them safe during the day. We also have turnover on staffing. And so while we may have somebody who is able to do this type of programming and is interested in it, they may end up having to move or change jobs or change careers for some reason. And so there's all those different kinds of things that can set things back. We also know funding is an option. And Evie already, without knowing, primed us very well for this moment when she was talking about, hey, we still have some questions about some funding that we're trying to get answers for you all. And here's what we have right now. A lot of programming, there's costs associated with things. However, with prevention programming, there are a lot of options for grant-funded work and organizations. So like the stuff that we do here at the Center for Suicide Prevention and Research, everything that we do is free of charge. We have this ability to fund it thanks to our hospital support and some private funding and some grant funding as well. So there's options that we can use to work around that, but that is still a huge barrier, especially to think about when we look at, we have to add all these programs. Another one here is kind of this engagement or participation, both from an administrative level, from a student level. We still have a lot of stigma around mental health. We know that our younger generations have done a lot to kind of change that and change the narrative and conversations that they have. But this is still something that is wide-reaching and wide-stretching among our young people and older folks as well. And the thing we're going to focus some time on here today is actually the barrier that legal requirements cause. And that one may seem a little bit counterintuitive, but we're going to kind of dive into that a little bit here. So when we think about a legal requirement or what law is here to do, it is mainly the role of law is to be ensuring that we are complying with a minimum standard. It is not there to define what our best practices should be. And having this minimum standard definition is extremely important. I do not want to take away from that, and I don't want anybody to be leaving today hearing me think that that's what I was saying. Having these types of checks and balances in place are extremely important and integral to the system. But when we think about, I'll use the example of just kind of your local police officers, local law enforcement as an example. When they're out on patrol, they're not out there looking for, hey, where's a kid who's helping the neighbor who just had a stroke mow their lawn? Where's the person who's donating to charity and kind of helping better their community? They're not out there looking for those people and saying, hey, great job, keep doing more of that. They're out there saying, hey, where are things happening that are not what we should be doing, and intervening in those areas. And that's really what the kind of function of law is in our society, is to keep checks on what we shouldn't be doing, not to promote what we should be doing. Taking this idea here and sidestepping real quick to House Bill 123, and many of you know this is the Safe Student Act. This is a great milestone that we have in kind of the prevention space, looking at kind of getting this type of intervention and programming into kind of a codified requirement that schools have to follow. So I'm extremely excited about that, and I'm in big support of that. It is also a large bill. There's a lot of things that are involved in it, but I'm going to call out a little bit here before we keep going about kind of the suicide specific stuff in there. So when we look at House Bill 123 requirements, just real quick, first one you've got there is a requirement for 1 hour of suicide and violence prevention and social inclusion education for our grades 6 through 12 each year. So technically what that means is that each year you have to have 6 hours of education, 1 hour per grade. When we look at staff, there's a requirement that every 2 years, staff receive a training, all staff in the school, about identifying concerns for suicide, identifying warning signs and risk factors, and then how to respond appropriately to help young people seek support that they might need. And then schools are also required to have a policy in place and programming in place to support and navigate a crisis should those occur, whether that be a mental health crisis, a physical safety crisis, whatever that may look like. There is that requirement to have policies in place for prevention, intervention, and postvention. However, even though we have all these elements here, there are still some pretty big limitations within the House bill and kind of the requirements that it makes here. We'll spend a little bit of time talking about some of these here, but one of the big ones that, when we look at House bill and some of the limitations that it has, because this was when it was designed, it was really designed to be a starting point. It wasn't designed to be the end goal. It was designed to be the start, the minimum requirement that we have to meet. So one of the things that it does is it defines a minimum dosing. This is the minimum amount of prevention programming that we have to do. It is not saying that this is the level that is the effective dosing or the effective amount of programming or programs that are going to be moving that needle, as it were. Another thing that has a limitation here is there really isn't a whole lot of guidance that is given. There's the ODE websites, there's all those different kind of supporting documents and things that are great and helpful. However, they don't really look at how do we apply this in a school setting. So how do we know which of the multiple programs to choose? Which one is the best of those and which one would be kind of the most appropriate to use in a different setting or a different environment? It's also looking at what is the best ways to intervene on a crisis. It has general guidelines for, but not really how to actually do that work when you're in a moment with a young person. So there's a lot of kind of gaps in how this actually is instructed to play out in a school environment. Part of this was because it was kind of on the schools to then determine, hey, what will work in my environment? However, that puts a lot of expectation and requirements on our schools, who we've already talked about are very overtaxed as it is. And so there's some gaps that happen with this kind of approach here. We also, with House bill, there really isn't any proactive oversight about this. So there's this requirement, there's this mandates that put out, but there is no auditing or there is no kind of real follow up with schools to make sure that proactively we have all of these things in place and we're doing the best practices as we know we should. There are retroactive consequences and oversight in that way, so that in the unfortunate event if a negative outcome does occur, then if it was found that a school did not comply with House Bill 123, then there would be consequences to that. But there's nothing proactively supporting schools in, hey, let's do a review and audit to make sure that you guys are doing everything to the best that you can. And the last one here, and this is kind of the counterintuitive one that we'll talk a little bit about, is this idea of regression back to the minimum. When we talk about defining a minimum requirement, a lot of the times what we see is that does bring folks who may not have been doing anything prior, that increases their programming and their interaction with this type of content. However, some of the things that we've seen, and I've personally consulted with school districts on this, many members of my team have as well here, we've actually seen that prior to House Bill, people were saying, hey, we know that our young people are having a tough time. We want to reach out. We want to figure out how to do the best. And so let's do our own research and kind of dig into what kind of the best practices are. And they would set up these nice pathways, these nice programs, these nice layers. And then when House Bill 123 came out and it said, hey, here's the requirements, some of those partners who were doing kind of above and beyond best practices that we know then said, well, we don't have to do all of this. We're going to go back to kind of what this minimum was. And so that was actually a loss that we saw, unfortunately, from some of the impact of House Bill in certain districts and certain schools. As I kind of talk through this and say all these things here, I don't say all of this to be kind of critical of House Bill 123. As I mentioned earlier, it is a fantastic milestone that we have, that we are starting to integrate these things into law and making this be a conversation that we have at that kind of state level, that administrative level, from a governmental standpoint. It was just that. It was designed to be a starting point. And so we're going to talk a little bit today here about how to move past this starting point. So we have a foundation, we have somewhere to start, but what are the ways that we can kind of improve our prevention practices as we go through here? And as we go through, also know we're going to talk a little bit about this at the end here, is that this is not something that is, hey, we have to do all of this tomorrow. We got to get this all sorted. These types of things where we're looking at kind of moving towards best practices, it is a journey. It is something that what we want to think about and what we want to kind of plan for is how do we do a little bit better each day, each month, each school year, and not beat ourselves up if we feel like we maybe aren't at the best. Okay, so that's kind of what we're going to be talking about today. The three elements when we think about this kind of how do we apply prevention programming best practices that I'm going to be focusing on here today is thinking about this idea of evidence-based and what that actually means. Thinking about kind of how we can diversify programming and use that as a way to be able to kind of improve the prevention work that we're doing in our organizations. And then briefly touching about kind of the importance of following implementation recommendations when we're thinking about implementation of programming. When we think about evidence here, one thing that and this is going to be a very simplified version. So if there's anybody out there who has done research, who has their PhDs, this is a very simplified version of stuff that you have already done and have looked at, but we're going to talk about it in the context of prevention here real quick. But when we look at this idea of evidence, it really falls on kind of a continuum. One program saying or one thing saying, we have the evidence base here, we're an evidence-based intervention, is not always equal to another program's evidence base or another program's support. One of the things, this is a kind of a behind the scenes limitation in kind of the House Bill process, is that House Bill 123, when a program is applying for inclusion on that list, we as a program are required to define what our supporting level of evidence is. It's broken down in the House Bill application, and we have to be able to provide our documentation and our clinical rationale for why we meet within which domain or which level of evidence. However, once that application is submitted, that information then is no longer like publicly available. It's not made present for anybody as they're kind of thinking through programming and, which ones should I do? Which ones should I choose from this list? It's just kind of dumped in as this is all of our evidence-based programs. And so when we think about what kind of the evidence is, we want to be thinking about when we have the opportunity, and this is not something, that anyone expects for any one person really, kind of especially in the school setting, to be spending hours and hours combing through. There's folks like me, like Evie, like the rest of the team that we have here, are wonderful folks in the ESCs who that's what we do. We work on these types of things. We consult on these things. So that's not something that is to say, you have to bear the brunt and the burden of all of this, of trying to figure out what the different levels of evidence are and where it is in different programs. But there are differences. And so when we think about, especially the kind of the current prevention programming that is out there, there's three kind of strata that I want to kind of break this into or talk about. Going kind of from highest to lowest here as far as like the most persuasive or the most solid type of evidence that we have. First is one ones that we're looking at with behavioral outcomes. So when we think about this one, a lot of these, just due to the complexity of mental health, are still a little bit more reliant on self-report. But these are ones where kind of the program was designed or the research was designed in such a way where we have comparison groups and we are actually looking at comparing behaviors and not just perceptions. We're looking at, hey, how is this actually impacting a young person's help-seeking behavior, their support-seeking, all these types of things, and actually having a translation from knowledge into practice in their lives. The next kind of tier here, moving kind of down the list here, would be this idea of what we have as like reported perceptions. With these ones, these are still great studies. These are still things that are important to have. But these are ones that are looking primarily not at a behavior associated with an outcome, but just more of the student's perceived change, of perceived knowledge change, of perceived value. A lot of these kind of have checkpoints at multiple times. We think longitudinally, going out over several months to see the maintenance of this. But they aren't looking at the translation of this knowledge or perception into action. It's just looking at kind of have my perceptions changed, which is extremely important and extremely valuable. But that is kind of the first step to behavior change. And so we have some programs that have evaluated that behavioral outcome and some that have only kind of evaluated that perceived outcome that our students are telling us about. And then at kind of the lowest idea here in this general breakdown of evidence informed or of evidence-based programming is what we would call informed interventions. And basically what an informed intervention is it is a program that hasn't necessarily done all of its own research or its own random trials or its own kind of comparison studies, but it is a program that has looked at what we know other programs have done that have done these types of more rigorous experimentation to be able to say, hey, this worked over there and this is what we know worked and was valuable in that program. If we take that information and we take what we know works and then shift how it's presented a little bit or shift the implementation structure a little bit to adapt it to be able to be more accessible or more engaging or more fill in the blank, we have every reason to believe that it will have the same impact here. And so that's the idea of what we call implementation science and strategies, where we are looking at how we can adapt an evidence-based intervention into a new mode or a new medium to then help it reach, go through different barriers to be able to reach more young people and be more accessible. And so as you are applying for a program on the House bill list, you have to differentiate between these three as a program who is applying. But when it actually gets on the list, that information is no longer required to be kind of known out there or kind of posted everywhere, which when we go back to some of those limitations here, when we talk about guidance, this is one of those areas where there's some reduced guidance. Thinking about diversity in programming here as well, there's an analogy that I kind of want to use as we go through. You see the picture of your local Planet Fitness over there on the right. But when we think about programming, all right, every program has a different strength. There's a different thing that it focuses on. And there's no one program that can meet the needs of every single student. The idea that we'll talk about here is if you go to the gym and every time you go to the gym, you go to the bench press and you always do a bench press, you're going to be really good at doing the bench press and you technically will be doing exercise. But I had a friend who did this in high school. Whenever he would play volleyball with us, he broke his ankle 3 times because he had no muscle mass below his waist. And so he was exercising. If you were due to these random polls on people who do exercise, yes, he's in there, he's doing this, but he wasn't doing a well-rounded program. He wasn't doing well-rounded interventions in that type of domain. Same with education here. If we think about kind of history class, right? We would never do 9th grade history on the Civil War, 9th grade, 10th grade, 11th grade, 12th grade. We would never do that. If we were to do something like that, that's what we call a PhD program. And every time we go deeper and deeper and more specific and more detailed into different topics within that kind of general theme. However, what oftentimes happens, and I've had a lot of folks talk to me about this, is we will choose one prevention program and we will do that with every grade every year. And then we are surprised at some point when we say, hey, our young people are tuning this out, or they're not really paying attention to it, or they're making fun of this program. I'm not sure what's going on. And so we have this where in prevention, we'll choose to do the same program every year, but in no other source of kind of education will we choose to do those types of things. When we repeat the same thing too much, it becomes boring. We become complacent in our implementations of it. And so that's something that when we look at best practices here, we really want to be bringing in multiple programs to the extent that we're able to. So that way we can have different strengths presented to our young people. One limitation on this here is that we actually, and as Evie mentioned, there is no research out there. There is not a study that has been done. There is not some thing I can point to you on that says this is the program that we should kind of lay, or this is how we should do it. You should do this program in this grade, followed by this program in order to achieve the best outcomes for our young people. That unfortunately doesn't exist. We do have actually some folks here at our center who are actually doing a research study. It started this year and is rolling out next school year. And so within the next 2 to 3 years, we're hoping to have at least the start of some answers to this question. But as of today, this doesn't exist. And this is not something that has been offered as guidance. And so this is, again, kind of a limitation that we have. We have to do programming, but how we should do it best, we're not really sure. With these types of different programs as well, we have what we call promotion programs and prevention programs, which really are kind of two sides of the same coin here. When we think about these things, promotion is this idea of I'm going to use an analogy of a bucket, actually, rather than what we have on the slide here. When we think about promotion programming, if you have a bucket that's full of water, promotion programming is this kind of general education where we're looking at resiliency and well-being. Where we are trying to be able to say, let's make this bucket so it can hold more water so that we're able to fill it up more and pour into that so that our young people have more to draw from. Looking on the other side of the coin, prevention is this idea here of not necessarily changing the size of the bucket, but more of saying, hey, there's some holes that are showing up in the bucket. There's some negative things. There's some poor outcomes. We need to be reducing those. And so it's looking at plugging those holes within the bucket. If we just plug holes, then we're never going to be able to kind of have our young people grow and flourish and kind of have all these new skills and fill them up more. If we only focus on making the bucket builder or pouring into it, eventually, if as those holes form, we're going to be pouring water into a sieve and not actually into a bucket. And so we have different programs that have different focuses, and it's very important for us to have both of those together so that we're focusing not only on filling a bucket, but also making sure that what's in the bucket stays in the bucket. A thing that I'll call out specifically around suicide prevention here, and kind of this idea of prevention programming. A myth or something that is oftentimes talked about in kind of the stigma related thing is that if we work on suicide specifically, or if we target suicide specifically, then that's going to create a problem or cause a problem. However, what we know is actually the opposite of that. The more we target suicide as a specific concern, that actually increases the safety of our schools and our communities, because we are targeting this as something that and really trying to focus specifically on reducing it or changing it. The idea here is this: we are in prevention programming. When you do it, there is a possibility that you might experience an uptick in concerns or things like that related to suicide. However, I'll use another kind of story here to explain when we talk about this, and I've used this with a lot of different schools that I've consulted with, is that when you think about programming, especially like with suicide, think about digging a hole. If you get a shovel, you're going to dig a hole. As you're digging, you run into a rock. You choosing to dig a hole did not create a rock there. It did not put a rock there. It did not make that problem in front of you. What digging did was it revealed that there was a rock below the surface. And so when we look at this type of targeted programming, yes, it is possible that when we really start to hone in on these things, we may identify some more concerns. But that is a good thing. When we think about the statistics that we have from like the Youth Risk Behavior Survey, when schools say, hey, we never have this. This isn't a problem that we experience. This is other people's problems. Those always kind of raise red flags for me because we know statistically that that's not possible. We know that our young people are experiencing these concerns. And so we really want to make sure that we are creating an environment that allows us to effectively identify and provide support to our young people who are experiencing concerns, and create an environment that allows them to come forward with those in a safe way, which is what targeted suicide programming does. It does not create the concern. It just allows an opportunity for young people to express those concerns and share those concerns to seek help. Another question with this kind of diversified programming that I also often get is if we're using different programs, aren't we going to have conflicting messages or conflicting things happening in there? To which I say no. Actually, all good prevention programming shares this kind of similar structure. It's this idea of we need to be able to identify a concern and we need to teach folks to be able to do that. We need to teach them once they identify a concern, whether in themselves or in someone else, they have to be able to respond to that concern in a helpful and responsive way. And then once they've kind of navigated that identification and initial triage, as it were, initial kind of response to it, we need to be able to have these pathways for seeking support. This looks different, depending on if this is an adult or a young person that we're educating on. But no matter what type of prevention program or promotion program that you're using, they all share this same theme. And so when we diversify programming, it doesn't counter each other. It actually reinforces each other. And it says, hey, this isn't just one person saying this. This is a community of people who are saying the same messages and the same ideas to reinforce each other. Looking at kind of House bill specifically and kind of how we can think about applying this idea here of different strengths in program and diversity within programs and kind of the kind of landscape that we have out available to us. These are some of the big programs that I hear most often talk to me about, that we as a school are doing. And so I kind of wanted to just break these down real quick in a little chart here, looking at kind of what our actual evidence level is, like if we were to look at a House bill application, and kind of what the different strengths are to these programs. All of these programs and all the prevention work that we have has a place. We just want to think about what's the best ways that we can utilize things and overlap things to be able to complement each other. So the best two programs that we have out there right now, as far as evidence-based goes, looking at kind of what's on the House bill list specifically, is the Sources of Strength program, which you were all here learning about today, and then the Signs of Suicide program. Those are kind of our two gold standards in evidence-based interventions that we have. Sources of Strength, fantastic job at peer-to-peer connectedness, looking at kind of how do we build a culture and build these kind of peer leaders to be able to make change and culture shifts within our school. Signs of Suicide does a great job on this kind of education where we're looking at specific concerns. How are we addressing these specific concerns and building skills to kind of reduce a risk? And this also has a screening element to it, which a lot of other programs don't have, where we're actually specifically screening and following up with young people who may be in need of additional support. Looking at some of the other programs that we have out there, Erica's Lighthouse, another big program. I actually do really like this program here. It is a really good job with depression education and does a lot of extra work and focus on parent education and bringing parents in. But when we look at the evidence here, this one would be kind of more under that perception-based level of where kind of, they've done a lot of good work and good research on how this impacted the perceptions of students, but not necessarily on the behavioral outcomes of things. The program that I manage in partnership with Evie here is Be Present Ohio, the online experience. Some of you have probably heard me talk about this program before, so I will not do that again here. But this program is one of those more informed programs. What we did is we took what we know works from Signs of Suicide and Sources of Strength, put it together, and then we said, how do you want to learn about this to young people? So we pulled in that implementation science to bring about this in a new way. And so we focus a lot on gamified curriculum and how we have social media interactions. And then we also pull in this idea of a COPE ahead plan that's personalized for each student that they're going to receive. Sandy Hook is another big one. It is very good at violence prevention. And it is really focusing, they have, again, that kind of perception level of research that they have behind them of the impact that students think this has. Teen mental health first aid, Adapt for Life, those as well. I'm going to speed up just a little bit here in the interest of time so y'all can have a few moments to talk with each other here. But this is just kind of an idea here to look at. There's different strengths that different programs have. And by bringing them together, we can really kind of capitalize on the different strengths that each program has. The way this diversification can look, and again, this is just a sample here, is looking at House bill, we have grades 6 through 12. What this might look like is each grade, each year, we choose a different program to roll out with that grade. And it doesn't necessarily have to be this expensive or extensive, and there are different programs that are available in different regions. But the way we can kind of look at this, for example, 6th grade, you do the Sources Elementary. 7th grade, you bring in Signs of Suicide to do some screening elements. 8th grade, you have that COPE ahead plan and gamified elements through Be Present Ohio. That's going to be preparing kids for that kind of transition into high school. Ninth grade, you do sources of strength again. The secondary program start to build that culture in the school. 10th grade, you repeat signs of suicide because you have new folks who have channeled in from different schools. You have new folks who have moved there, and then you redo the screening process. 11th grade, you roll out Sandy Hook Promise. It's an easy program to implement and can be rolled out very quickly. And then 12th grade, you kind of cap things off with Erica's Lighthouse. And so we have these layers of programs where we're teaching something different each year. So we're showing the same information slightly differently each year, I should say, to be able to help young people continue to engage with the curriculum and be able to engage with this content in new ways each year. Now, I say all of this very well knowing that we talked about all those barriers earlier, and there are a lot of challenges to doing this type of thing. All right. And so this is again where I want to call us back to we don't want to be beating ourselves up about best practice. We want to be focusing on working towards better practice each day. Some of the challenges with kind of doing this diversified programming, one is staff, just as we talked about earlier. It's hard to change programming, especially when you have one approved underneath of your administration. It's also, we've talked a lot about how there's not a whole lot of transparency in some things. And so knowing which program we should choose versus other programming. A lot of folks I have talked with have had a poor experience with an implementation of a program. And so then they no longer want to do that program, even if it is kind of an evidence-based program. They had a poor experience with an implementer, not necessarily with the program, but with an implementer of it. Cost, we talk about more programs, talk about potentially more cost, being able to bring those in. And then also just kind of going back to this idea of changing programs, right? It's hard enough to find time to fit in a program, let alone to be looking at kind of how do we do the training and the planning and the implementation of multiple different programs. When we think about all of these, though, and this is something that, I do a lot of conversations with schools around, there are a lot of ways we can get around these. When we look at staffing, big thing that I talk about with this is don't put all of the responsibilities of this on one person. Diffuse your responsibilities across different professionals, across different domains, across different grades. So that way you have this depth and breadth of experienced folks and knowledgeable folks who, again, all know different strengths, but can come together and kind of help plan programming. When we think about kind of changing programming, again, this is something where it doesn't have to be, oh my gosh, next year we have to quickly change all the programs that we have. It can be, hey, next school year, let's maintain what we've got. And then let's think about how we can plan to do something a little bit different, how we can add something in to make things a little bit better. We do a step each year, we do a step over time, and before we know it, we're going to be doing best practices. Being kind of unsure about what the programming is, I'm more than happy to talk with anybody and everybody. I'm free of charge to anybody who wants to talk with me or email me. So is the rest of the people at our center. OSPF does very similar things. Evie has actually connected me with many, many people who have emailed her, and she has said, why don't you talk to Ben for a little bit? So we all work very closely with each other to be able to help navigate these things with folks. Implementation experience. The thing I'll say about this is there are different organizations that do things differently. And I could name 10 organizations that do, for example, the Signs of Suicide program in Ohio. If you have a poor experience with one implementer, it doesn't mean that the program is bad. Just explore who else might be able to bring that service to you guys. Or if you were able to be trained in it yourselves, like you were all doing here for sources. Cost, real short, and unfortunately the current political environment makes this sometimes we put my foot in my mouth, but many programs do have a lot of grant funding associated with them and are offered either free of charge or at very reduced cost. However, what the House bill actually, the list says on the ODE's website is that it will just say some costs associated. It isn't always the most helpful in that way because I know, for example, there's a program that says some costs associated. It is $100 one time. When we look at a school's budget, $100 one time is basically nothing. And so it says there's a cost associated when the cost is actually basically negligible. So just kind of make sure that you're not taking that as face value that, oh, there's a cost, there's no way around this. And then when we look at kind of scheduling here, there are programs that are a little bit more involved to implement. And there are other programs that are a little bit easier to implement. And so when we think about a schedule or how we could kind of think about this, intersperse those. Don't do 3 super involved programs right back to back. Don't set yourself up for those types of things. Intersperse the more complex with the easier to implement. And last thing here before we go into kind of a little bit of a breakout activity for a few minutes here, is the important infidelity with implementation. A lot of what I do is consulting with schools and connecting them with kind of experts in different programs around the state on, hey, we really want to do this program. However, X, Y, and Z reason we don't feel like we're able to right now. And so schools will have access to a program. They will then make changes to that program in order to kind of make it fit within what they need to. And this idea here of fidelity, we do need flexibility. We do need to be able to adapt things and modify things in order to work within different environments and with different groups of people. However, when we look at these types of things, there are some things that we can modify and still remain faithful to what we know made the evidence be when it did the research. And then there are other things that really are integral to programming and really integral to say, hey, if we pull this out, then we are no longer actually an evidence-based program because we've modified it too much. And so when we think about modifications, the thing that I always just call out and really want to say is that having flexibility in how we implement programs and roll them out is essential. However, when you're talking about those or thinking about those, just make sure you're consulting with the teams who run these programs. So that way, they can help advise you on, hey, this would be a great modification that would be maintaining the integrity of the program. Whereas, this one may not be the best to be rolling out at this time. Well, I appreciate y'all listening to me talk here. I'm going to sip some tea, and we are going to get you guys an opportunity to talk with each other. So what I want y'all to do here is we're going to take, looking at the time here, let's take 8 minutes in the breakout rooms if we can. And I want you guys to just kind of spend a little bit of time in a small group here talking about what you all use to fulfill House Bill 123 within your schools, within your organizations. Two, what are some of the challenges that you have had in implementing the current programming that you have? And what did you find helpful as you were navigating those to get things in place? And then also, I want you to talk about or think about, hey, this might be some ways that other schools have navigated this or other places have navigated this. How might I be able to bring something that somebody else did back to my school to be able to advocate for some improved programming? And improved programming can look any way. Right? I don't want you to guys feel locked in on one thing, but just how could you learn from what somebody else has experienced to be able to kind of change things in your school? And then when you come back, I'd like for a couple people to be willing to share just one idea that they had from their time talking. All right. Well, I hope those was wonderful conversations for all y'all. I know one of the things that Evie had said that a lot of you had reported when we were kind of doing the registration was that a lot of people were hoping to have opportunities to connect with each other and kind of have these conversations. So I hope you were able to have some fun in that short time. What I'll kind of ask now, just in the interest of time, I'm actually going to throw this slide up here. If anybody has questions or concerns or follow up about kind of our talk here today, this QR code takes you to our website where you can learn more about the programming that we offer here at the Center for Suicide Prevention and Research. And you are always welcome to shoot me an email directly. I'm always happy to talk about anything. So I'll leave this up here as we chat, but would love to hear, if one or two of you brave souls would be willing to step up for me and share just a little bit about, hey, what was that thing that you talked about or somebody talked about in your group, in your breakout room that was, hey, I'd like to take this back to my school. I'd like to bring this back as a way I can advocate.
Well, I'll start because we had the best group ever, and we were just getting to know each other and I was so inspired by all the different things people are doing, starting up new programs, wanted to carry out the sources work, on so many different levels. I do mediation at a juvenile justice center and parent project, but I'm a social worker for 33 years. But everybody, we had a psychologist and we had people that were involved in so many different angles of prevention and helping people. If anything else, I was very inspired by how many cool ways people want to make a difference. So that's what I'm going to take away.
I love to hear that. There's a lot of wonderful people out there who are doing this work, and many of them are on this call here today. I'll ask for one other brave soul.
I was in the breakout room 9, and we talked a lot about the fact that we loved your slide on the plan of doing the 12th through or 6th through 12th grade to where you're doing diverse things every year. So you're not having the kids be bored and be hearing the same thing and those sorts of things. So several of the people in my group was impressed with that, and I might steal that when I took a picture of it.
You guys are welcome to steal anything from me. It is all freely given. I'm so glad it sounded like that one was helpful. Something I will, just kind of throw out as, a little bit of a reminder on that one is it doesn't have to follow that exact pattern. You guys within schools, this is where I encourage you guys to think about, what will be working best within our schedule. If a program might fit better eighth grade or seventh grade or ninth grade, plan that out. Think about how it'll fit within your organization. As I said, right now, we don't have this is the exact map. What we know is that we just need to be adding in more diverse options as we go through this kind of curriculum planning. So I'm glad that sample was helpful.
And our question was recommendation on how often students should be screened. Within your grade level breakdown of programming, would you recommend completing the signs of suicide screening even if you are using a different program in a grade level?
That is a fantastic question, one that we often get. The answer that I have for you on that one is that there is not actually right now when we think about universal screening in kind of this public health capacity in a school, we don't have again, definitive answer from the research that says oh, it should be this grade, this grade, this grade, and it should be at this frequency. We don't have that information right now, unfortunately. The general recommendation that we oftentimes give or think about is when we look at this kind of universal screening, once in middle school, once in high school, universally, and then always screening whenever there is an indicated concern or an indicated reason that a young person might need follow-up. The one thing that I do always just say, and I always will harp on this till I can no longer speak, if you do implement a screening program, please make sure that you have a plan in place for following up with those screens. It is, if you screen and then don't follow up on it, the message that you are sharing with young people is that we wanted to hear from you, but we're not actually going to listen. And so if you are doing these screenings, which is a wonderful thing to be doing, we catch and identify a lot of young people with that rock analogy that I spoke about earlier. We catch a lot of young people that we otherwise wouldn't and are able to save countless lives that way. However, when you are doing a screening, you have to make sure that you have a plan in place for how you are going to follow up with any concerns that may be found out from that.
Thanks so much, Ben. Another person asked, and if folks need to take their break, we are going to be starting at 11:30, but for those of you who are able to stay, so we had a question asking if the House Bill 123 requirements for staff are the same. So prior law required schools to have biannual suicide prevention trainings. House Bill 123 just makes that an annual suicide prevention training for staff. And so that is covered within each of the programs that are on the House Bill 123 approved programs list. I think with that, we'll have to pause questions, but please reach out to Ben if you guys would like to pick at his brain a little bit more. I know I always do. Thank you, Ben, so much for providing this incredible keynote. We'll see everybody else here at 11:30, but Mamta is going to go ahead and open up the breakout room. So please say yes to that before you go on your break if you can. And then anybody who's remaining, just let us know through chat or other means what breakout you would like to go to, and then we will just manually put you into those breakout rooms.
Wonderful to talk with you all here today. If anybody's still in the room, I just want to throw one thing out here to that question as y'all are transferring, so please feel free to transfer away or to your break. That question on staff education. So the way that a House Bill program actually states that it has to be is that if in order to be qualified for the House Bill 123 list, it has to train some staff. It doesn't specify how many staff. The actual, though, there's a separate requirement in law that says all staff have to be trained. So if you do a House Bill 123 program, you will train some of your adult staff, but there's also a requirement to train all staff. And so some programs offer that all staff trainings. Other programs only offer training to staff who are implementing the program.
Okay. Is there guidelines on which programs meet that requirement?
That is a fantastic question. So actually, not many programs do training for all staff.
Okay.
They do it for all implementing staff, but not all staff in the building. I know ODE has a training module that they use. It has good information. The only thing that I do always just like to call out about it is that if you have ever done yearly learning center modules for your
Yep.
training, it's about the same. So there is that small limitation that staff eventually will learn the answers and not pay attention to it every year.
Yeah, I think that's a big gap.
Yeah, so we don't have an answer for that right here for you today. I can tell you that the Signs of Suicide program, that if anybody partners with us here at Nationwide Children's, we do an all staff training, but we also are not across the whole state, unfortunately.
Right. And I think our district is doing that. I'm with Upper Arlington.
Oh, yeah. Yeah. Then you definitely
Yeah.
are.
Yeah. So I would like to chat with you offline eventually. I'll reach out, but I think that
Yeah.
that's helpful. Just wanting to make sure. And when you say all staff based on the House bill, does that include coaches and other everybody else that has interactions with students? Is there anything
Forget the
legally?
exact verbiage, but it's essentially, if I remember right, it's teachers, educators, admin, front office folks, and then there's a caveat in there that says, and any other staff deemed necessary or appropriate by school administration. So that's one of the ambiguity questions where it's actually like, what actually doesn't need to be,
Yeah.
where the law is a little bit unclear.
Great. Okay. Thanks. I look forward to talking with you later.